Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Progress happens in inches, but each year it does feel like we see progress, and that's kind of the beauty of working at the state level. Things move a little bit quicker and policy impacts happen a little bit more immediately.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world, to help you make informed decisions to live your best life. But before we get started, we want to be sure that everyone takes a listen to all of GHLF's great podcasts. We have so many to choose from.
We sure do, and as a reminder to our listeners, you can check them all out at ghlf.org/listen. This week we'll give a shout out to Talking Head Pain, hosted by our colleague Joe Coe. One of the latest episodes features a conversation with Hannah Frost, and Joe and Hannah really just discuss paraclimbing with migraine, the effect migraine had on Hannah's career, and how she was able to come back to the sport with the help of the community.
Paraclimbing, very cool.
Very cool. All right, let's start with a listener comment. Ready, Steven?
I am ready.
This one is from Rachel M., who wrote, "Relatable show. Thank you."
Thanks, Rachel, and thanks for listening. We encourage everyone to be sure to tell a friend and hit that subscribe button.
This week, we have a special guest with us, Nathaniel Brown, who's the Director of Advocacy with the Chronic Disease Coalition, and he spoke with us about his experience advocating on healthcare issues before state legislatures.
Yeah, we had a really great conversation with him about the policies he focuses on with the Chronic Disease Coalition and the importance of patient advocacy. But first, we have some news updates.
So our first news update, Stephen, I know you love these. We have the Patient Support Program quick poll results.
I love it.
So this time we had asked about the flu vaccine and people's plan to get that protection. Are you ready for this?
Yes.
62% have spoken to their doctor about getting the flu shot, and of those, 97% said their doctor recommended getting the flu vaccine.
I am curious who those 3% are. What is up with that?
Well, maybe they've had an allergic reaction or something.
Right, fair enough.
But yeah, I got my flu shot yesterday, and I have the sore arm and a little fatigued, but mostly really optimistic about the protection that I now have.
Great, good for you. I will be getting mine shortly as well.
Oh, nice. And then just rounding out the poll, 94% said they do usually get their flu shot, and 71% plan to get it, and 23% have already got it. So it looks like our community is getting that protection this flu season.
Excellent. In other news, Medicare Part B premiums are set to actually decrease. You don't hear that too often in the healthcare world, premiums going down. The Biden administration announced that Medicare Part B premiums will decrease in 2023, making it the first time that this cost has been lowered in more than a decade.
More than a decade. That's really amazing, especially because I know in 2022, Medicare B premiums rose by a decent amount, I think around 14%. So, to have that come down in the next year, especially if it hasn't in more than a decade, is really promising.
Yeah, I don't want to get too excited. They're being lowered by 3% or $5.20 per month, going from $170.10 a month to $164.90 per month. And the annual deductible will also fall from $233 to $226. But again, these are not eye-popping numbers, but going down is always better than going up.
Yeah, I think that every dollar counts, especially when you live with a chronic illness like our community does. It's really expensive to continuously pay for it. So, at least this is something. And of course, we always hope for more because everyone should have access to affordable health care.
Absolutely. Every dollar does count. You're right about that.
So, our last piece of news here, the CDC says masks are no longer required in some, I'll emphasize that, some hospital and nursing homes. So basically, they said that facilities in area without high transmission can decide for themselves whether to require, everyone, doctors, patients, and visitors to wear masks or not.
Yeah, the agency now has exceptions for where masking, and I'll put this in quotes, remains recommended. These include situations like during an outbreak among patients or when caring for patients who are moderately to severely immunocompromised.
This actually reminds me of a few months ago, we were talking about how there was some uproar in our community when patients came into the hospital with N95s, and they were asked to put on a surgical mask handed out at the door instead. And, they said, "Why are you requiring me to wear a less protective mask? I don't really feel safe in this healthcare setting." And the quote you just said, when caring for moderately or severely immunocompromised patients, that says masks are required, but sometimes it's not obvious if that person is or isn't. So someone may walk in the room without one, or, they may go up to the desk, and it's not that it's embarrassing to ask, but sometimes it's just so exhausting to continuously advocate for yourself like that.
Yeah, I can't imagine any well-respected healthcare facility, doctor's office included, and certainly a hospital or a nursing home that would not require it. It just doesn't make any sense, particularly as we enter flu season. We've spoken about this before. It seems like this should be the norm going forward. Like, hey, let's keep viruses at bay. And, COVID itself is still out there. It's even more virulent than flu is. And as I said, now you're layering on top of that, we're entering flu season. It boggles my mind that, forgetting about what the CDC's guidance is or what local regulations say, how any healthcare facility would not require it. I can't understand it.
For sure. I actually saw my rheumatologist yesterday, and often you have to change into that gown when you're at the doctor, and typically they say what clothing garments stay on, and she said, "And your mask remains on." And I was really relieved that she had pointed that out, and now I know that she points that out to her patients, and I just felt so comforted by that. There wasn't a question of, what the expectation is. It was, keep your mask on, and there's signs all over, keep your mask on, and I hope that continues, because as we've seen with guidance, when it's lessened, people kind of are quick to jump on it and throw it out the door, and it's hard to say some and not all require masks, so this makes me a little nervous.
Yeah, look, there are certain places in this world that I want a little heightened sense of security when it comes to keeping us safe from viruses. Hospitals, for sure. I want masks. I want people in restaurants washing their hands a heck of a lot more than I wash my hands. And that's just the way it should be, in my humble opinion.
Amen to that. I totally agree. Patients should feel comfortable accessing the care that they need without fear of contracting another virus because basic precautions aren't being met.
Well, 73% of the country, as of our recording, is still having high rates of transmission. So you should expect to still see masks in your local health facilities.
I would say that's good news. We expect to see masks, but not great news to hear that there's high rates of transmission. So a little bittersweet hearing that, but I hope to still see the masks.
Well, like we mentioned, we spoke with our friend Nathaniel about patient advocacy from the Chronic Disease Coalition.
And he's here today to talk about his experience advocating on healthcare issues before state legislatures. Welcome, Nathaniel.
Hey, thank you very much for having me.
Well, why don't you start by introducing yourself and, the Chronic Disease Coalition and your role there?
So I am the Director of Advocacy for the Chronic Disease Coalition. We're a nationwide nonprofit focused on education and advocacy in the healthcare space, specifically for Americans with chronic illness. We represent people with, from multiple sclerosis to cancer to arthritis to psoriasis. We're a Big 10 organization. Something like half of Americans are living with a chronic disease. And so we focus on the issues that are important to them and their families and help advocate and shape public policy to their benefit. So my role as the Director of Advocacy is really to keep an eye on state legislatures in all 50 states and Congress to see what is currently being debated, where we can plug in, where we can help our patient advocate for themselves and support them in their own advocacy journeys, and really just help raise their voices in the public process.
That's awesome and such important work. You mentioned that you follow the state legislatures and what's going on. Talk to me about some of the healthcare issues that are most important to you and your patient community.
Absolutely. Every year, we undergo a very comprehensive policy development process where we bring in our patient advocates, we bring in our board members and our members and partners in each of our areas. And so what comes out of that is a policy platform. And this year, we are reforming step therapy and prior authorization, expanding telehealth when it makes sense for the patient and their provider, and then the Medigap issue as well. We have really seen a need increase in several states for access to Medicare supplemental insurance. And so that's been sort of our top tier issues, but we also work very heavily to pass living donor protections, to establish chronic kidney and rare disease task forces at the state level so that the patient voice is sure to be represented and is codified. And we also weave in equity work and issues that are important, to all of our patients, that kind of weave into each of those separate policy buckets.
You mentioned step therapy, which is also a big one for us. And for those who don't know, this is when an insurance company essentially denies your medication and say that you have to try a different one and fail on that first before you could get the one originally prescribed by your doctor. This is an issue we've been fighting for years. There's also federal legislation that we've been trying to champion. And I'm wondering, from your perspective, what types of progress have you seen over the years with either step therapy or an issue like that, where it feels like we're constantly trying to raise our voices and maybe it's not moving forward so quickly?
Yeah, it can be frustrating for sure. As you know, progress happens in inches, but each year it does feel like we see progress. And that's kind of the beauty of working at the state level. Things move a little bit quicker and policy impacts happen a little bit more immediately. This year, we've seen progress on step therapy in Florida. Massachusetts is working on a very comprehensive bill. Colorado passed a comprehensive bill. And it's always a little bit of a give and take, because step therapy reform is common sense to patients and to advocates like us, but it's not necessarily a popular notion. And so we work in different levels. So that could look, so when you're talking about step therapy reform, that could go into certain buckets, right? So we could be working to pass, peer reviews, or we could ensure that there's adequate notice time so that when an insurance company is going to force a patient to fail first on another medication, they know about it beforehand. And so there's a lot of different avenues to make progress and sort of chip away at this big issue. And like I said, each state is different. I think that there's a very strong effort at the federal level, which we're also engaged in, to get a nationwide comprehensive legislation passed. But yeah, progress happens in inches for sure.
And, how can patients get involved in that progress? What kind of work do you do with people living with chronic disease to help raise their voice?
Yeah, so that's really our North Star at the Chronic Disease Coalition. Our mission is to help patients advocate for themselves and to support them on that journey. And we have a very active ambassador program with ambassadors in most states. And when we do that policy development that I mentioned, and when I'm talking to them, almost always they have experience with step therapy because their condition is chronic. It's going to be expensive to manage. And so they're very concerned that they're going to be forced to try and fail on a drug that their doctor hasn't prescribed. And so the message of kind of protecting that patient-provider relationship is really what guides us and is an easy one for patient ambassadors to communicate to their legislators. And so what our ambassadors do is they connect with their legislators, whether at the state or federal level, and we're here to support them, help them prepare for the meeting, follow up, set the meeting, that kind of thing, basically to make it as easy as possible because, right, they have day jobs. This is what we're paid to do. And so we really try and make it an easy process for them and an effective process too, because when it comes to healthcare advocacy, patient stories is really what moves the needle. And I'm sure you know this. I mean, when a patient comes in and says, I missed X months of treatment on that I knew worked, but I had to switch jobs and I switched insurance plans and now I'm back where I started and I'm having, health problems because of that. That's a lot more impactful than sort of the legislative lobbying advocacy work that we do. So that's why we try and connect patients with decision makers and move the needle that way.
And what types of calls to action do you send out to patients? Like if patients are looking to get involved, what kinds of things could they get involved with?
Yeah, so a big part of my job is, keeping eyes and ears out for legislation that could impact patients. But when we send out a call to action, it's typically around a bill that's got some legs, that's moving in the legislature. We don't do a lot of opposition work. I think that's kind of why I love this job, is because the legislation we support is typically fairly bipartisan and it's positive. And so we'll send out a call to action asking our advocates to connect with their legislators, customizing messages and doing that kind of thing. That's obviously sort of the surface level advocacy work. We exist to help them along that sort of advocacy ladder. And so that's where our ambassadors come in. We set up meetings between them and their legislator, help them, prepare to testify, and then kind of work our way up. And so there's sort of a suite of options in terms of patient engagement, but our calls to action are kind of where to start.
And what is your advice for someone looking to get started to, raise their voice and advocate, but is maybe a little nervous? Speaking to a legislator can sound quite intimidating. You just mentioned making things easy to understand. Policy is complicated. What's your advice for someone looking to get into that?
Yeah, beyond the obvious, right? Go to our website and sign up for our newsletter, follow us on social media. I would say, just don't be afraid of it. because I meet with ambassadors and with legislators frequently. And I can tell you, I've never seen a legislator be aggressive or mean or anything like that towards a patient who is sharing their story. They are called to public service. They want to represent their constituents, but they don't have all the answers and they don't have all the stories, and patients provide that. And they really have an opportunity, find your legislator and ask for a 15-minute meeting just to let them know you're a constituent, you live with X chronic disease, and you care about positive healthcare policy. That's really all it needs to be. And I think that there's no reason to be intimidated by an elected official. They're there to serve.
Well, thank you. And thank you for joining us on the Health Advocates.
Yeah, and thank you. I really believe in this work, as I know you both do. It's really important work, and I'm blessed to do it.
Thank you, Nathaniel. Well, that was a great discussion.
Yeah, it's always great to hear what our peers and colleagues around the country are doing to help people living with chronic disease.
Absolutely.
Well, Steven, that brings us to the close of our show. What'd you learn today?
Well, I'll just say I really learned, once again, the importance of having different groups and different organizations to maximize our numbers, because when patients come together, we really are more powerful. And so it was great. It was a great discussion.
And I learned from you that some of the premiums and healthcare costs in Medicare Part B are coming down. And while it may be a small change, incremental change does matter.
Well, we hope that you learned something too. We'd love to hear from you about your advocacy stories. Send your email to thehealthadvocates@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes.
Also email us if you want to subscribe to our weekly newsletter.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts, and definitely let your friends and family know about us. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.